I'm Laci Dykstra, nurse practitioner in family practice at the Red Rock Clinic in Pella. I've been a nurse practitioner since 2014, but prior to that I did work as an obstetrical nurse here at the hospital. Well, initially I got into medicine. I was actually a pre-veterinarian major at Kansas State University and had recently transferred to Iowa State, and I was in a terrible accident. I was transferred via ambulance. The EMTs were amazing. The paramedic crew was so great, and then I got an emergency room, and the care I had just really set my mind at ease and my family's mind at ease. And so I think that through that accident, I really felt like I was in the wrong field. I was a pre-veterinarian major, and I just decided I'd really always kind of had a calling to be a nurse, and that was what did the trick. I then went to nursing school, and from there really just loved taking care of people, and then later became a nurse practitioner. So after nursing school, I was a medical surgical nurse for just a little bit and oriented to a labor and delivery floor. Worked postpartum there for just over a year and absolutely loved obstetrical medicine. I loved taking care of mom and baby both, but really enjoyed taking care of mom during labor, providing that comfort for her and just making sure her labor process went as smoothly as possible. Decided to go back to be a nurse practitioner, like I said, in family medicine. I actually had a child with some special medical needs, and I watched Dr. Haynes, of all people, take really great care of her. It was amazing, actually, and he was so compassionate about making sure that my husband and I were comfortable with her care and that she was healthy, and that's really what got me into family medicine. You know, it's not always the specialist that's providing care to those children. It's their family doctor, the person who they need in a hurry. I remember, for example, an instance, we were rushing to the emergency room because she was having a crisis at the time, and he met me in the ER to make sure things were really going well. And that was what flipped the switch for, I knew that family medicine is where I needed to be. And so I think that's kind of the care I want all my patients to have. Just to know that someone's there to listen and to make sure that they're comfortable in every moment of their healthcare process. You go to the emergency room, you don't know who's going to care for you, right? You may not know that provider, but just knowing that Dr. Haynes would know that we were there and that he was in the ER or close by to help with anything we might have needed was really settling to us, and it helped us know that she would be cared for well. I'm Laci Dykstra. Thank you for choosing Knoxville Hospital and Clinics.